Hi, everybody. Welcome back to the Mass Retirees Weekly Update. Today's Friday, November 12th. I'm Sean Duhamel. Thank you so much for joining with us again this week. I have two very special guests with me today. Our association's legislative liaison, Nancy McGovern, who also serves as one of our healthcare experts. Nancy spearheads all of our outreach with the state's group insurance commission, as well as our local city and town public employee committees. And also joining with us, who needs absolutely no introduction, particularly for those of you who have been Mass Retirees members for a long time. You know and love our insurance coordinator, Cheryl Stillman, who does an amazing job of working with members and helping to resolve and rectify any insurance claims problems you have, any denials, any bills that come out of the blue. Cheryl works her magic. Cheryl, I don't know how you do it, but somehow you get the job done. And we always say this about you: if this was a baseball team, you would be in the Hall of Fame for the batting average you have of helping to resolve members' claims. So if you haven't figured it out yet, today's episode or today's report, we're going to focus on healthcare, and in particular, the meeting we're having a week from today, Friday, November 19th, with the Group Insurance Commission and their executive director, Matt Vino. But before I get into those details, I just want to give a quick update and thank those of you who took the time last week to participate in our association's annual meeting. We had just shy of 4,100 members join us last Friday afternoon for nearly an hour and a half. We updated you on what's going on with the association, talked about the things that we're focused on for the coming year, and spent a good half hour or more taking questions from members. We also, for the first time in almost 2 years, were able to reinstate a door prize program. For those of you who have attended Mass Retirees meetings in person in the past, you know that it's a tradition that we always draw names out of a hat at the end of a meeting, and we have given away or raffled off Watson's chocolates, their homemade chocolates from Walpole, Mass, Red Sox tickets and Patriots tickets at times, gift certificates. And one of the things that we've really missed greatly is, because of the pandemic, is the ability to get together with you in person and see you face to face. So Frank Valeri, our association president, really wanted to do something a little extra special with this year's annual meeting, despite the fact that it had to be virtual once again. So we have selected 10 members randomly who participated all the way through to the end of last week's meeting, and who may have asked questions during the meeting. By now, we've reached out to almost all 10 people to let you know that you've won a $25 gift certificate to Stop and Shop. Stop and Shop, of course, has supermarket locations throughout New England and really throughout the country now. There's several locations down in Florida. So all of the members who we selected do live in regional areas or geographic locations that you can take advantage of shopping at Stop and Shop. So with that, let me get into the heart of our topic this week, which again is healthcare. Now, we are focused heavily on health insurance issues, and we always have been. Mass Retirees traditionally has been one of the leading organizations, not just here in Massachusetts, but nationally, in terms of retiree healthcare policy, health insurance policy, everything really related to your health, whether it's mental health, physical health, dental health. These are all things that are important to us, and we have been very proud to have some expertise in those areas and be relied upon by policymakers to share our expertise and to represent our members in those areas. One of the things that we're most heavily focused on right now is the fact that next year, by late spring, it's anticipated that the state's Group Insurance Commission will have gone out to bid for all of the health insurance contracts, as well as the 2 pharmaceutical benefits contracts that are now in existence. Under state law, every 5 years, the GIC has to go out to bid for all of these services. And next year is the deadline for them to go out. Now, the GIC has been putting a lot of work into this process already. They're well ahead of the game going into 2022. And to his credit, GIC Executive Director Matt Vino, from the moment he took the job as Executive Director back in February of 2020, just as the pandemic started, Matt became the executive director of the GIC, and talk about jumping into the frying pan. But he's made a point of working closely with Nancy and myself and Frank Valeri and our whole team to solicit our opinions and our thoughts and what the GIC and Matt thought would be a good idea is to once again hear directly from our members. Now, you may recall that a little bit more than a year ago, Matt did participate in a teletown hall event with us. It was the first time, I believe, in the history of the GIC that one of their executive directors had actually interacted directly with our members, and it was a tremendous hit. We had a lot of positive feedback, both from our members as well as from Matt. And Matt had reached out to us in advance of the GIC issuing their RFP, or RFRs as they're known, next year. He wanted to come back to our members, talk to you about the process that they're about to begin, and most importantly, hear your thoughts, your opinions, your concerns as to what the GIC should be thinking about and taking into consideration as they start this process. Now, this is not just important to those of you who are insured under the GIC. Because of the state health insurance law, the decisions and the policy set forth by the GIC can very quickly become local policy as well. And Nancy's going to talk a little bit about that in a moment in our interaction with our local PEC committees. But before we get into the details of next week's meeting and some of the things that you should be thinking about, Nancy, could you just quickly walk through what we're anticipating happening with the GIC over the next few months, kind of what the general timeline is and what this means?
Sure, Sean. So as you were saying, this meeting's coming up on Friday, and it really is sort of at a critical juncture in the RFR process for the GIC. Over the past several months, they've taken steps to engage their stakeholders. I've participated in several meetings with our labor colleagues. They did a survey with active members to get their thoughts on what their plans looked like, what they liked about them, what they would be willing to give up or pay a little bit more for, and things like that. So this meeting on Friday is our opportunity to do that part of the process. So it really is critical for folks to participate and really think about what they like about their plans. So as we move forward, we're looking at November through February. They're going to be doing some more strategy meetings at their commission meetings, which for folks, if they'd like to watch, they are on YouTube, which is where you're watching our videos weekly. The GIC has their own channel. You can subscribe, and every third Thursday of the month, they host their meeting at 8:30. So they've been presenting to the commissioners their strategy over the next few months. We are anticipating in April that the medical RFR will be released, and then in June, the pharmacy, and then May through August, they will be accepting bids and reviewing them. Then in the fall of 2022, they will be voting on both the medical and the pharmacy vendors, at which time the implementation of those new plans will take place in calendar year 2023 for open enrollment for plans to start July 1 of 2023. So it seems like it's far away, but in the grand scheme of the process, it really isn't. And so, this is going to start moving very quickly as we come into the beginning of next year. So it's really important for folks to continue to participate in the meeting Friday, or if there's any other opportunities for folks to give feedback as we head into this process. So I think that's what we're looking for at the timeline. And the commission has been very transparent about the timeline of the process. It should be noted that when the RFR is issued, they can no longer publicly discuss it. It's how our procurement bid laws work in the state. So this window of opportunity, will close very quickly once that occurs. So we want to make sure people take advantage of it.
Oh, absolutely. It's extremely important that we have this opportunity, to let our thoughts be known. In the past, we've had a limited ability to do this. Now, Mass Retirees has always been very on top of everything that happens at the GIC. We attend every one of their meetings. We always have. But our ability to give direct feedback, and in particular for you to give your direct feedback as a member and as someone who relies on this health insurance, that's always been very limited in the past. So this is a unique opportunity. Now, at the end of the day, there is no guarantee that we're going to like and support every single decision that is made. They have a very difficult job to do next year of selecting these health insurance companies to provide benefits for you and establishing what the co-payments and the deductibles and all the plan design. And at the end of the day, we may not like every decision, but on the other hand, we may be very, very supportive of what they come out with. That's what we're hoping for. But as I said before, one of the key things here is that the decisions made by the GIC are not just going to impact state retirees and those municipal retirees who are insured through the GIC, but they potentially could impact everyone. And Nancy, could you talk a little bit about the PECs and why it is that the cities and towns can implement GIC lookalike plans if they so choose?
So in 2011, there was a change in the law on how municipal members bargain for their health insurance. We covered it in a couple of the Voice articles recently on the anniversary of the change. Within that, so there's two processes. There's what we call Section 19, which is coalition bargaining, and then there is the new section that they implemented, which was called 21 through 23. Both processes developed a public employee committee. Those are made up of a representative from Mass Retirees, as well as the designees from the unions. So as part of 21 through 23, they established a benchmark plan that all municipal health insurance plans could be pegged against. Currently, that is the Trust Navigator plan. And so the co-pays and the deductible structure of the Trust Navigator is what the benchmark is for municipal plans, and we call them GIC lookalike plans. So if you have Blue Cross and Blue Shield, whether it's directly through them or through Maya, or you belong to West Suburban or Cape Cod, or all of those plans could potentially look like the benchmark plan. So with this new process and the RFR coming out, depending on what those plan structures look like, which is your co-pays and your deductibles, and then what the most utilized plan becomes, whether or not that remains, a similar Trust Navigator plan or something that is structured a little differently, that then becomes the benchmark for these municipal plans. So it's critical that even if you, aren't necessarily receiving your insurance at the municipal level through the GIC, that you also take this opportunity to participate in the meeting, because what changes come to the GIC could potentially trickle down to these other plans and purchasing groups in the municipality. So we want to make sure that everybody is, participating and fully aware of what is happening with the state plans, because it really could have a significant impact on what happens when we come out of the enrollment in 23. So.
Yeah, so again, it goes without saying that we are literally all in this together, and even the private sector plans in Massachusetts, because the GIC insures some 450,000 or so people. It is the largest health insurance plan operating in the Commonwealth, whether it be public sector or private sector. So the policies and the decisions made by the GIC have a ripple effect on everything. So that's why this is so important. Now, Cheryl, in terms of the specific things that our members should be keeping in mind, I know that you interact with members day in and day out. You know, you're hearing members' concerns. You know, one of the things, of course, that we are very focused on, that we hear all the time about, is for our non-Medicare retirees. So in other words, retirees who are not eligible for Medicare, they didn't earn their 40 quarters, either through their own work history or their spouse's work history. So regardless of their age, they are part of the active employee non-Medicare plans, which tend to be very expensive, very high co-payments and deductibles. And as folks get older and are utilizing their health insurance more, this in many cases can become very costly. And we hear from you all the time about this. And we know that at the municipal level, we have a growing number of municipalities that have opted into a Medicare buy-in program where they can buy their way into Medicare for their non-Medicare retirees. We have been working with and encouraging the GIC to do the same thing. Next week on Tuesday, I believe, the Joint Committee on Public Service is having a public hearing on legislation that we have filed that would require the GIC to move forward with this program. And the GIC has not been opposed to doing this, but there are some logistical challenges. There are, for instance, about 10,000 retirees that have been identified that would be part of this program. Well, each one of those 10,000 people would have to make their own application, or the GIC would have to make their own application and do individual calculations. So there's a lot of work that needs to go into making that happen. However, it's important that we find a way to get it done. And what we are looking at now is potentially a Medicare buy-in program coinciding with the new contracts that could be issued under these RFRs, and have it be implemented as of July 1st of 23. However, if you are a non-Medicare retiree insured through the GIC, please join us next week. If you have questions or you want to make a comment to Matt, we're going to call on you. We want him to hear directly from you of why this is important to you as an individual. And he's very well aware of this. So, and I know a number of you watching this, we've interacted more than once, whether it's Nancy and Cheryl or myself. We've heard you loud and clear, but we want to give you the opportunity to speak directly with Matt about how important this is, or any other subject. So with that in mind, Cheryl, what are some of the things that you hear from members that people should be keeping in mind, and maybe take a moment next week to either they themselves ask Matt a question or make a comment, or if you're not comfortable speaking, for yourself, you can always submit a written question to Nancy or to myself or Cheryl, and we're happy to submit it to Matt as well. But Cheryl, what are some of the things that you're specifically hearing from members?
I get calls every day about people who want freedom of choice by having more hospitals and doctors under their plan. I also get calls from people that they would like to have a good customer service under their plan to be able to answer questions and problems they have with their plan. And then I also get many calls from out-of-state members who do not live in Massachusetts, wanting to know why there's such a shortage of doctors that they can turn to. But they would absolutely want, again, the freedom of choice to have more doctors and hospitals under their plan. Also, they would like to have more than one option to choose from for their health plan other than Unicare. That's an option that a lot of them call about, that they just want a choice to be able to pick something other than Unicare if they want it. But the most important thing our out-of-state members talk about is if they go to a hospital for a test or an operation, the hospital may be covered in full under their plan. But then again, the doctors who are taking care of them are not part of the group, and they have to pay the full hospital bill. Also, there are many, many, many good things about the GIC that our customers never want to change. Some of these things are a person every 2 years, a person can have a complete eye exam with a refraction, which is fully covered. by their plan. Also, people are happy and do not want to change the hearing aid program. Because for a $2,000 hearing aid, it's only going to cost them as little as $300, which is a wonderful, wonderful, wonderful benefit for our members. And finally, Sean, people are getting very confused about the formulary drug under the prescription plan. They get a prescription from their pharmacy. It costs them $20. Then when they go to refill it again, it costs them $80. Why? What's the difference? Why are they spending so much more money on a prescription?
Yeah.
What is the reason? These are questions I get all the time. There's more, but these are right now are important questions that they would like to be answered by our members. And can I say one thing? If they don't understand what I'm talking about or want more information, they can always call me. Look in the back of their membership card. My number is there. I can be called anytime they want to talk. Thank you, Sean.
Thank you, Cheryl. And my guess is the call that just came in while we've been speaking was probably from a member.
Yes, I'm sorry.
Don't be sorry. Don't be sorry. And whoever that was, sorry, Cheryl, we'll get back to you as soon as we're done recording this. But all of us get multiple calls from members every single day. It's a very, very important part of the job that we do on your behalf is, that we're here and we're accessible. As much as we're focused on our advocacy and our, policy, formulation and so forth, it's just as important that we're here to take those phone calls and answer your questions and give you a little bit of peace of mind, when something comes up. So if you have a problem with your health insurance, Cheryl is the primary person to contact, but, if you can't get through to Cheryl, call Nancy, call myself, call Frank, call Bill. We're all here and we're all well-versed in this stuff. And we're going to do everything we can to help you out. I think one of the things to keep in mind going into next week's meeting with the GIC, if you are interested in not just participating in listening, that's very important that you get as much information as possible, that you're well informed. But if you are a local PEC member, for instance, or if you're just a member with a general question or comment, what we want to try to make sure that Matt Vino and the GIC come away with is some clear indication of what is it that the retirees would like the GIC to be considering, what we would like the GIC to have as their primary goals through this RFR process. And we're trying to be realistic in our approach. Of course, we would all like to have free health insurance benefits. But we're not going to get free health insurance benefits. That's not a reasonable request, I guess, in 2021. Those days are gone. However, we do believe that we can achieve the highest quality and affordable health insurance possible by working together and coming up with some new ideas and new solutions. And it's important that you have a voice in this process, that you have input. And we think at the end of the day, you're going to have better and stronger benefits as a result of all this. Because as Nancy said, next spring, when these RFRs are sent out, the curtain goes up and we can't have this kind of interaction anymore. And there's going to be a period of a few months where we're going to be kept in the dark in terms of what's going on. So now is the time for us to be doing this work. And I encourage you, if you are available next Friday at 1 o'clock, please participate. Remember, there are two ways that you can participate. We publish in our newsletter and on the back of your membership card the toll-free number to call to automatically connect to the meeting. Call that number at the time of the meeting, not in advance. You'll be connected. The other way to connect is if we have your telephone number on file, you will receive an automated message from me next Friday. All you need to do is answer the phone, you stay on the line, and the system automatically connects you to the meeting. And if you have a question or if you want to make a comment during the meeting, you press 0 on your telephone keypad. That's going to connect you with our staff, and you can then get involved in the meeting. So I'm going to wrap things up for today. Nancy, Cheryl, anything that you'd like to add before we sign off for now?
Yes, remember, people, listen to Sean. It's very important for you to be aware of the meeting next Friday. This is your chance to ask questions about things you don't understand. So please, please take part in it and call. Thank you.
I just wanted to remind folks too that if they had, a question prior and they're not comfortable asking it maybe the day of or anything like that, or if it doesn't necessarily have to be a question. It can be if you have feedback about something that you like about your plan, something like that you'd like to share prior, reach out to one of us by email or phone, and we'll be happy to share that on your behalf. We want to make sure that we have the most open dialogue we can with Matt during this time and his staff, because they're going to be, working on this process in the next couple of months. So
exactly. As Nancy said, it's just as important to remind the GIC of the positive things about your health insurance benefits that you like, that are working for you, that are important to you, that we don't want to see changed, as it is for them to hear complaints. It's really, things are equally important. And quite honestly, we get very few complaints about the GIC plans, other than probably the biggest concern is the costs of copayments and deductibles. But traditionally, these benefits have been excellent. We want to make sure they continue to be excellent. And that's why it's so important that we're doing these types of meetings and have this kind of input. But with that, I'm going to sign off. Thank you so much for tuning in, and we will see you again next week. Bye, everybody.
Bye-bye.